So first of all, what is it? A bursa is a small sac filled with synovial fluid. It's located in your joints, in your shoulders, knees, and hips. And it acts as a cushion for bones and muscles. And then bursitis is a condition where the bursa sac becomes inflamed and it can cause severe pain and discomfort. So some symptoms for bursitis, it's a localized illness, so it usually only affects one bursa at a time. In that specific area, you might feel aching, stiffness, pain, or swelling during movement or pressure, and swelling and redness. And then you should see your doctor if you have severe pain limiting your range of motion, and excessive swelling or redness, rash, shooting pain, or a fever can actually develop. And so our assessment, the assessment is very similar to our diagnosis, but these two things I would like to consider more of assessment would be the physical exam. So the doctor is going to observe you, how much movement you can have without pain. Also, if you're experiencing fever-like symptoms, the doctor may check your temperature. So this could indicate that you are in sepsis, which basically means that your bursitis has caused infection in your body. This could also be cause to some of that redness and swelling. So some of the symptoms that you're going to watch for would be chills, sweating, aching, fatigue, headache, and other things. And some risk factors for this disease. Older adults have a much higher rates of bursitis just due to their less movement, and people with manual labor jobs or who do extreme sports put more stress on their joints. So I personally have dealt with bursitis in my life as a runner. So basically it just flares up and it's really hard to get that slowing down if you keep repeating that motion. So the most important thing for your treatment is to really rest and ice, and we'll talk later about other treatments for this condition. And then other things like diabetes, gout, and rheumatoid arthritis can also increase your risks. For diagnosis, you're going to use imaging tests such as x-rays because you want to eliminate other causes of this discomfort. So things like x-rays, MRIs, and ultrasounds can be used. And then also lab tests. What we can actually do is go in and remove some of the fluid from the bursa and check and see if it is infection, and that can help us pinpoint the cause of the inflammation and pain as well. So treatment, medications like over-the-counter ibuprofen can be used to help reduce some of that inflammation and pain. And then also therapy exercises can help strengthen the muscles in that area and help you get better range of motion. And then injections can also help with localized pain. So I personally got a cortisone injection in my hip, and that helps a lot, just reducing the pain and the swelling in that area. And this treatment generally works pretty quickly, and likely is all that you will need to treat bursitis. And then also conservative measures, you want to make sure you're getting adequate rest, icing properly, and taking your pain meds to help relieve that discomfort. Then the prognosis, oftentimes patients will make a full recovery. Extreme interventions such as surgery to remove the inflamed bursa is very rare. Often people can treat this condition by rest and over-the-counter medications, therapies, but it is not uncommon to need a cortisone injection, especially with elderly patients. And then another thing to watch for is it's very common for flare-ups of bursitis to happen. So once you've dealt with bursitis, you'll likely have it again later in your life at some point. And then in order to best treat bursitis, it's important that you are recording all your symptoms, activities, and medications, because this can help doctors remove other causes and best treat the bursitis and find the cause of your pain. And then the patient can make the necessary lifestyle changes to promote the healing of their joints. And then for follow-up, it's important to know your body. Listen to your body when it's telling you that it needs rest. Be sure to track your symptoms of pain. And then it's important to use good body mechanics. That can be a good preventative measure to decrease your chance of bursitis. And then stretching is also very important. I found this helpful for me too, just like your tight muscles can also put a lot of stress on your joints because it is kind of squeezing between the bone and the muscles. So, and that's important for people who, whether you're athletic, whether you're working in a manual labor job, just it's important for all of us to stretch. So, we're excited.